I am going to be telling you one story about people who have been probably not heard since morning, and since they are people and people do age, we need to know this story, and we also need to listen to it very carefully, because aging is a challenge. Aging is a challenge which all of us will face. But when you are gender diverse, or so to say come under the umbrella of transgender, then this challenge multiplies. So I want you to look at this presentation or this story keeping those people in mind who we do not think about because they are not visible to us. People who, when they become visible also, we turn our eyes away from. People who have a very poor health-seeking behavior. People who need to be very, very vocal for you and me to take notice. Yes, there are challenges. So, the first challenge that I faced is to see how I can roll my slides. So, can you give me that pointer? You do it for me? Very good. So, this is what was told to us, and I am sure these challenges were covered in the morning. Don't bother to read them because this is more what we know. What is written down? If you do a Google search and say challenges that people face when they age, and challenges which are there for delivery of health care, you will get all these. And you see, there we have nicely put them in nice boxes. But there is a bigger challenge. And I will ask him to move the slide. Sir, can you give me the pointer? I'll do it myself. It doesn't work? Okay. So, what is put here are the more important things which I want to talk about. Because these are challenges which people who are diverse face. And they are personal issues, they are interpersonal issues, they are community issues, and they are societal issues. We in academia have this habit of putting stuff in headings and silos. But let me tell you that when you are dealing with transgender and gender diverse people, please allow the thing to flow. Because though when we talk about society and we say that if you are going to be providing health care to people who are diverse, or who do not fit into the binary of gender, then we need to address transphobia which the society has. And transphobia comes from me not knowing about the person who's come to my place. It deals with how do I get this person who has got very poor health-seeking behavior come into my facility and listen to the schemes that the government has put in. That is a challenge. The second challenge comes from the community. And could you just move the... Yeah? One more? Yes. So, when we want to engage with people, we need to take what we have developed to them. But will they listen? Well, the biggest challenge that now comes here is one of mistrust. Mistrust because they have been marginalized. So whatever schemes that the government puts up, if we are not able to engage with those people, then they are lost to us. There are interpersonal issues also. and the interpersonal issues would be, telling them about have you provided for end-of-life care? Something which all of us cis-het people take for granted. I have my employer who says, okay, this is put for your old age. Now, this is your pension. And I, as a family person, also prioritize my finances, my resources, so that I can be looked after when I'm not earning. But when you look at transgender people, then it's a different story altogether. Because here the priority was of first and foremost proving that they are normal, aligning their bodies to the gender that they perceive. Agitating and advocating for their rights. When we bring healthcare facilities to them, and when we talk about savings, well, there are none. So then comes a question of insurance. Then comes a question that if you are a citizen of this nation who is entitled to enjoy all that has been put in the Constitution, all privileges that come to us by being citizens of this country, then is the state looking after me? Will they step in and cover this part, understanding those three things that I've already talked about my not being in a position to take care of myself. And you know what? Statistics scare me further. Because as I go on to the last bit, where people tell me that you're going to age and we have made provisions for you, I am very afraid that am I going to live to enjoy those? Because unlike you, I take so many other things to support my existence. Hence, when we look at this entire set of challenges that one faces at a personal level, which come from me as an individual who's diverse, me as an individual who does not have the luxury of a family support. Probably I am living with an adopted family who themselves are struggling. When I look at my interpersonal barriers, I get further overwhelmed. Because even if I, take the courage of reaching a healthcare facility which is designed for adult care, are they going to give it to me without discrimination? Is this society geared up to handle what my special issues are? Because the previous slide, which showed 4 boxes with more than 20 barriers, which people like you and me who identify as cis-het face, I have more. So the journey of policymakers who provide for the aging population is there, and this is picked up from the report that has been prepared by Niti Aayog as recently as February 2024, and it shows a very nice graph till 2019 when new policies have come in. I would like you to press again, but does it talk about the transgender and gender diverse people? Have we forgotten that in 2019 there was an act also which came out, which was called the Transgender Persons Protection of Rights Act, and quickly followed by the Transgender Persons Protection of Rights Rules, which told us that we need to look at these people and protect their rights. And among those rights also come rights of elderly people. This is a very beautiful document that the Niti Aayog has put out. I would request you all to go through this, because it does tell us how much our country has done for care of seniors. And it lists all the schemes that are there. But if you were to do one small experiment of opening this PDF and typing the word transgender, guess how many times that word would have appeared in this document? Once. We are not that bad. Once. And that too clubbed with other marginalized people. When I look at the world or the global picture, and I am told that India houses more than 1/5 of the world population, and I read statistics and I hear prevalence of gender incongruence is somewhere between 2 to 5%, and I wonder how many people are affected. And then I look at this document, then I think that it is time for us to wake up and start looking at what we have, the infrastructure that we have, and start thinking with transgender and gender diverse people in mind. When we are looking with this prism, the right way would be from this space. When I say this space, academician, where we start educating ourselves, we start talking about curriculum changes, where we start talking about trainings, about certifications, and start talking about holistic transgender health care. And see, if you have to look after old people, then you have to make sure that they reach old age. No? Old age is 60 plus. But guess what the statistics say? That transgender people, their life expectancy is hovering between the 4th and 5th decade. So I don't know how many of them will reach 60, but I hope with this dialogue starting here, we will definitely start providing for them. We need a manual. You need a manual. Because if this talk has stimulated a little empathy in you, then you need to know how to do it. And let me congratulate IIHMR for being leaders again, for taking this first step of getting this health manual rolling. And if things go as per plan, then probably this Christmas we will be gifting the government draft health manual, which will be talking about holistic management of transgender healthcare delivery. Don't you think that's important? Because only when you have cared for people from -9 are you assured that they will be there to take the care for which this symposium is being organized today. See how many verticals need to move together. The government, international agencies, voluntary sector, private providers. The symposium, when you look at the agenda, has put everybody here. But this needs to be done with the focus, keeping the transgender and gender diverse people in mind. Do you know that this is the decade for aging that the UN has declared? I'm sure it was told earlier. And these are the areas where UN expects us to work, and WHO is taking a lead on that. I would implore you, as students, as researchers, as teachers, as citizens, to see how we can work on these verticals, keeping transgender and gender diverse individuals in mind. A lot is talked about ageism. I am throwing one more word at you, which is called transism. And transism means what I think trans people should be doing. Where do I slot them? If I, in my mind, have not allowed them to progress from the traffic lights into classrooms, into white-collar jobs, then this ism needs to be handled first. Right? Yes, we need to cover all these very important topics. But then again, keep in mind the transgender and diverse individual who at 60 plus is now looking at care providers who have no idea about how he feels about his identity, who is subjected to abuse in healthcare facilities by care providers. We talk about assistive technology, but then have we given them a platform where they can come and access this? Dementia and disability is given. It will happen to all of us. But if you are also taking cross hormones, if you are also living in an environment where nutrition is poor, there's no rocket science. What about pandemics? And the last pandemic, the transgender and gender diverse people had a very tough time. Are we gearing up for looking at them again? How do you get people who are comfortable living in their own cocoons to come out and do activity? This is something that the young people need to start thinking about. Niti Aayog does talk about all these verticals, but again, it is up to us to say that please put the transgender and gender diverse people in each of these verticals when you design programs. All good stories also have an end. I hope my story has stimulated you to think, and I'm here to take questions if there are any.